Hey, what's going on? It's your man BSwift from Hot 100.9, Indies hip hop station, inside of Inspire You, presented by Eskenazi Health. Now, we're going to have an amazing conversation with Dr. Rhyant from Eskenazi Health. He's actually at the campus on East 38th Street about your health. So hopefully this conversation inspires you to get your health in order. Now, what's going on, Dr. Rhyant?
Hey, I'm doing great, but that's BSwift. That's every day, good day, right? That you see, and always look forward to just trying to help somebody achieve whatever goals that they like to achieve. So it's good to be on with you. Thanks for having me on.
Oh, no, thank you for being a part of this. And we'll just get right into it because we was having some conversation off air before this started. And, we've been talking about physical wellness, mental wellness. And I'm just going to get right to it for those out there. 2025 is right around the corner. You kicking off the new year with a lot of personal goals, you know what I mean, for yourself. I know I am. We talked about how do physical wellness and mental wellness intersect with each other?
Yeah, I mean, there's been a lot. I mean, obviously, when you're thinking about health, I like to think of them all one and the same. They're just a part of just a different perspective of health. I mean, but traditionally, physical health has been something that people have embraced and felt more comfortable with. So it might be achieving a weight loss goal, it might be achieving a blood pressure goal, or in some sense a diabetes goal. So something more tangible, more in some sense measurable. But so that's kind of the physical. So people are usually comfortable coming in and talking about more of their physical goals. But what's gained more interest, and I think more has just as much relevance, maybe even more relevance, is this mental health trend where behavioral health is now becoming more accepted in all different communities, and particularly in the minority community as well. So how you approach life, whether it be an attitude, the mood that you experience life in, whether it be the depressed mood, anxious mood, or hopefully neither one of those things, just like a normal mood, I think those are just as important to take care of and address as what would be traditionally thought of health in more of the physical realms of that.
Now, as 2025 gets here, people are setting those new goals, right? Oh, I'm going to the gym. Oh, I'm losing weight. Like for myself, I'm getting off sugar for at least 30 days. It's a must for me.
Yeah.
What is a simple mindset shift to help people embrace this new journey? You know what I mean? That they're getting ready going, because it's a different lifestyle when you're used to eating whatever or drinking whatever. And now you're like, hey, I got a goal for myself. What are some simple things to help with that?
Well, I usually tell people, to set, there's a different level of goals that you can set, and setting, I don't want to say simple goals, but goals that are achievable, and at start, not to try to go too big or exorbitant. Small things can lead to bigger things, is kind of what I'm saying. So, losing 100 pounds might seem to be, kind of a little bit uh, challenging. But if you talk about losing a pound a week, or losing 2 pounds a week, or losing 5 or 10% of your body weight, that might be a different goal. So, I tell people to set goals that are achievable, that are measurable, and more importantly, that you feel personally that are meaningful to you. And not to set goals that are, coming from a different direction. Maybe a TV person might say you need to set a certain goal. Now, you need to put your own goals in your own personal perspective to make them meaningful, and also to make them something that can be motivating and help you achieve long-term health benefit.
No, amazing. Now, as we get ready to do this, how do we figure ways to get friends and family involved? I got an 8-year-old daughter. She's very active, of course, and pulling me out the house. And I'm like, I don't want to go outside today. And she's like, nope, we're going on a walk. But, how do we take our goals and our journeys and find out ways to bring our friends and family in this?
Well, you know what? Here's the thing. I think that once you set a goal and make that goal known, particularly to those, and share them with those who love you or care about you, you tend to attract and engage others into helping you either be accountable for those goals, or they participate and help you, motivate you in achieving those goals and staying consistent with those things. So I don't know if it's necessarily any trick, but you starting your goal and getting your mindset set, and then sharing that goal with loved ones or people that care and want to support you along this health journey and are kind of partnering with you or joining hands with you, so to speak. I think those are very effective ways. And one of the most effective drivers for people for their health, in my experience, is even if they don't do things for themselves, or they might not come up with this idea that I need to do it for myself, they are motivated and really connected to doing things so they can be around and be better for the ones that they love. So that's a
Now,
very powerful motivator.
I want to ask you this because the holidays is here, right? Of course,
Yes,
this is time where we forget about our health a little bit as we see cookies and cakes and sugar
sure,
and snacks. And,
absolutely.
this is time that sets off some triggering things for us. What are some ways to balance that out? Because now, again, it's holiday parties every week. There's Friendsmas and this, and you
Yes.
pull up and you've done amazingly well staying away from the snacks. And is there a way to balance continuing being healthy, but also getting a healthy indulgence of the bad stuff?
Well, I mean, that's life right there. What you just said in a nutshell. Life is about balance, and I think that there's nothing to say that you can't, have, for example, one cookie or participate in some of the events. I think but you have to have those things decided kind of before you go.
Yeah.
But take four pieces of cake, or eat five cookies, those types of things. It's not in the small indulgences. It's when those lead to kind of the overindulgence. Participating in holiday events, and it's different for different cultures and depending on kind of what your traditions are. I think that's important to be able to connect and to be around loved ones, and sometimes that includes eating in certain types of cultural food type of items. So I don't think there's any hard fast rule to say that you can't partake of a small piece of cake. I don't think that's a problem. I think what it becomes a problem when it becomes an overindulgence, and so one day becomes now 7 days in a row, or it becomes the whole 25 days or 30 days of the month type of thing. And that's where you start to stack those days and stack the calories, or kind of get away from some of the goals that you maybe have set before you, and then you leave more to set the day after New Year's. And that's kind of where you're like, oh my goodness, if I didn't get it so far out of bounds during the holidays, I might have had less to do during this January 1st, kind of this traditional where you kind of set all the goals that you didn't accomplish last year. So I like to tell my patients generally, start thinking now about your goals, so you don't have to make it a January 1st thing. You're making it more of a life choice, a life journey sense, and you tend to be more successful. And I guess in short, I mean, I try not to tell people that you don't have to isolate yourself or not partake of anything. Small bits, everything in kind of a balance is kind of what I advise my patients.
Now, I know you see people of all shapes, walks of lives that works many different jobs, and there's somebody out there that yo, I really want to do this, but I'm limited in space, or I'm in an
True.
office from 9 to 5, and I don't feel like I have the time to hit the gym. Do you have any go-to moves to help people stay active that might not have the time, in their words, or feel like they have the space to do things? Are there any simple little things we can do, whether it's home or office, that might keep us out of the gym but can still help us be active?
Oh, absolutely. And I think now more than ever, more people have access to, and I don't mean to promote, but the internet and certain websites they'll have, and I'm just going to name one. It's not a promotion, but YouTube also will have videos. And if you wanted to do a 10-minute routine, if you wanted to do, there's things called high intensity workouts. If you wanted to do a walking kind of in place. Kind of activity. I mean, there's a lot of different things that you can now do and be exposed to, that even if you just have just the space in front of your TV to do, or in a small space on the floor, you can engage in activities that will certainly benefit your health and give you the adequate, exercise, daily exercise that you need. So something as simple as walking in place, and things like in between. In This is if you're watching regular TV, in between the commercials, getting up and doing some movements during the commercial, period of time. Those are very simple things. What you want to do is just build a habit um, of just being active, and whether it's 5 minutes, 10 minutes, or 15 minutes, those add up over time.
No, definitely through those 2 minute commercial breaks, you can get a lot done. Like you say, watching the show that goes to commercial roughly 3, 4 times. Each one's about 2, 3 minutes. It's a great
Yeah.
workout,
Yeah.
in a half hour to an hour setting. That's an amazing work that
Yeah.
you just put in, and you're not even leaving the house, and you're enjoying yourself. Now, I want to switch gears a little bit. We talked about health, but and we're going to stay on the health thing. Me personally, I'll raise my hand to this. Like, I'm afraid of doctors. Like, I think my job knows that. As I've done better, thanks to you guys at Eskenazi Health, I have become a lot more better at going to get things done earlier instead of waiting to the last minute when I'm probably about to be on a deathbed. So I want to talk to you about some things with people out there that's like myself that wait to the last second to, oh, I ain't going to the doctor. I'm not going to the emergency room until I got to. And by the time you say that, it's a little too late, and you might not make it out of that place. Why is it important to go to the doctor, the hospital, get a primary physician early on before things happen that there's no reversal for?
Yeah, so I mean, I'm a family medicine doc, so I'm a primary care doctor. So I think we're a little bit biased. I think that the idea is I think it's very important to have relationship, and to form a relationship, and that you can, a person that you can talk to, that can be a consultant. You talked about setting health goals and things like that. I think it's very important to have those frameworks in place before you get to an urgent setting, or a kind of I hate to say a life or death situation. It's nice to have somebody that you've over the years, or maybe over months, have gotten to know, that you can trust and have confidence in when you have medical questions and you need some direction and some guidance, and on the certain concerns that all of us have as human beings concerning and regarding our health. So it's very important to form those relationships, and to have a general discussion about your health goals and what's important, and kind of get, for lack of a better word, a game plan. If you want to use a sport analogy, have a game plan, and maybe even have a coach, to help you, coach you through certain situations and give you that advice, that you can trust and have confidence in, because there's so much information that's now consumed on the internet, and everyone has a podcast about health. But more times than not, those individuals don't have a direct relationship with you, and that's probably the most important thing I could say. You probably can get the information a lot of places, but information with relationship with someone that's gonna partner with you, that you trust and have confidence in and can move forward, that's a very different type of healthcare relationship.
No, it's different, because I used to use Dr. Google a lot.
Yeah.
Until one day it told me my head was going to pop off because of my
Yeah.
cold. And I was like, you know what? This isn't the place to go anymore.
Yeah, there you go. There you go. Well, I'll be honest with you. Dr. Google sent a lot of people my way. So I won't be totally negative on Dr. Google, but Dr. Google didn't solve much. It kind of created more questions for people. But I think for information, there's a place for it. But I think, it's just like you said, I think it's the relationship and that confidence you have in that person, your health consultant, or your partner in health. I think that's where you can kind of get questions answered, and it makes it so that you have less anxiety about whatever you're concerned about, and can move forward and live life.
No, definitely. Now, let me ask you this. Yearly, there are some very important things that people should get done.
Sure.
Are there a couple, there are people out here watching who probably haven't been to the doctor, again, including myself on that. Are there some yearly checkups that people should definitely have on their list that they might need to start getting, and looking at possibly getting done, that you feel like, it might not be a bunch, but these 2 or 3 are very important yearly to have done?
Well, I'll talk about the I'll go a little bit beyond just the process of it. So, I mean, I think clearly there, I kind of maybe talked about the importance of having a relationship, having a healthcare consultant.
Yeah.
So even so, if you don't have big goals, you don't even have chronic medical issues, I think it's important to have that relationship, and it's important, just as important now as it's ever been in the 20 plus years that I've been involved, and I've actually been a physician. So that's the first key. The second thing is maybe to understand the context under which why we even have the kind of these recommended what we call annual examinations or preventative health care visits. They're really kind of structured to help mitigate some of the things that people die from. And I'll just start from there. A lot of people die from heart disease,
Yeah.
which is this, and then things like cancer, and there can be things as unintentional injuries. Those are, things that are motor vehicle accidents, fires, falls. And then recently we went through this pandemic and COVID was a really big deal. And kidney disease, chronic liver disease, cirrhosis, stroke, chronic, respiratory disease. Some people call it bronchitis, but we use a word called COPD or chronic obstructive pulmonary disease. And then you have Alzheimer's dementia, which is kind of the most common form of dementia. And then you have diabetes. So just those are the kind of the top 10, and you can look those up on the internet. It don't change much. They might change position, but those have been pretty consistent. And so really, looking at that, if you frame it like that, what do people die from? And you already got the relationship, then really that visit is really to talk about your health goals, but also to talk about the things that are predisposing you or might predispose you to having, for example, cardiovascular disease, things like high blood pressure. Most people don't know that blood pressure, the most common symptom of blood pressure, high blood pressure, is no symptom at all. And so people often don't even know that. So that's why we recommend, having that screen so you can become aware and you can start to do actions to mitigate that, because it correlates high for people to develop heart disease. Things like cancer. So a lot of things we talk about during that preventative screening, and it's dependent on your age and your risk, are screening against certain types of cancer. Some of the most common ones that we screen for in older adults. So if you're in your 20s, there's less than if you're, like, for example, in your 50s. So for example, if you're in your 50s, one of the common reasons for people to die, one of the most common, is colon cancer. And there are very, very effective ways to screen for colon cancer and find things at a moment in time where you don't have symptoms, and you can take care of those things easily or more effectively. Um, the other thing is lung cancer as well. And so you'll hear us talk about those types of screening, and we'll talk about smoking prevention or smoking cessation. So I can kind of go on, but most of the things that you're going to find during your annual health exam, number one, establishing that relationship, talking about what your goals are, but depending on your healthcare risks, and those are age, some demographics, African Americans can be at more high risk for certain diseases than, let's say, Caucasian Americans or Asian Americans. You might customize what things you might screen for, you might advise for different populations, different people, depending on their risk. So I don't want to drone on, but I think it's foundational for your health is to have that, number one, the relationship, but also have that cadence of every year coming in, and getting the best recommendations on what you can do to meet your health goals. And again, I think of myself more as a partner, more of a consultant, coach, however you want to put it, to helping you get where you want to get. So I know a lot of people are, I guess, understandably, I think they're probably at times they can be scared or apprehensive about having that relationship. It is kind of one of those times where you're a little bit vulnerable. Um, but if you could look at us as partners and folk that really are interested in helping you achieve your best health outcomes, I think that's if you can look at it that way, that's a better way to look at it. And then just get to know the person that you're consulting with. And so I don't know what to say anything different. I just think those are important things to do.
No, and that's important. And before I let you go, I just want to touch on one more thing, and only because I guess for me it's a little personal.
Yeah.
Colonoscopies, right?
Yes.
I turned 40 this year. My father's really been on my case. Like, I don't remember the age, but you need to get it done. And he like, because I had a scare like 14 years ago. It's very important that you get this done because I don't want you to be in the place where I was.
Yeah.
How early does should that detection start, or should we come and see you for that? Because I know in Black men and African American men, colon cancer is one of those silent killers that happen to take us out because we don't get that all the time. We don't always go get that check. So for me, I think this year has been let me ask questions because I've known a person or two that's lost their lives behind it. So I'm like, okay, when should I look at getting this check, especially having someone as my father who's had a scare? Is it important for me to do it early, or do I wait till the 45, 50-year-old mark to get that knocked out?
Well, that's actually a great question. I think that the higher your risk are, the recommendations change. So, but for an average person of average risk in general, in just a few years back, it always changes. So keep in contact with your physician, and they can always give you update. But in general, just recently, the screening was recommended in general if you're of average risk to start your screening at 45 years of age. Um, and So that's kind of a relative new thing for most, because most people had heard that it would be 50 years of age, but there's a recommendation to start screening at 45. So start to look a little bit younger. And then, I guess the top age in general, they usually say somewhere around 75 years of age. Now, those are general ranges and they'll change, but there are specific situations. And in your situation, where you've had, and it sounds like you might have had a first degree, we call first degree relative, brother, sister, mother, father, that type of thing. That's how we call first degree relatives. If you have a strong family history, and let's say your father had, colon cancer, or you have sisters and brothers or multiple individuals in your family have had colon cancer or have certain genetic predisposition to these types of cancers, then that's even more reason to create relationships with your physician, because your risk may be higher, and the recommendations for people in that population is to start screening earlier and start to look earlier, and usually they use a number, I think around 10 years before the age that your relative, I think, was diagnosed with it. So it gets a little bit complicated maybe a little bit in the weeds, but the point is, if you have a first degree relative that's had that cancer, you will do want to establish relationship and start talking to your physician so you can come up with a customized plan based off of recommendations and good science to start screening and start looking for things. And so in general, I think 45 to 75 years is kind of the general kind of age range. But for those who have the first degree relatives, I mean, I see starting even, I've seen numbers as early as 40 years of age.
Okay.
So yeah, so I guess in your scenario, that's a conversation you really need to have with your physician. And there's different techniques, things that are direct visualization. Colonoscopy is what's most common people know about, but there's also different types of testing depending on your risk and what's recommended.
Okay. Well, I thank you for that. And hopefully we have inspired some others like myself to jump on the health bandwagon and figure it out and get to come and see you guys. Again, come and see you. You're on the 38th Street campus of Eskenazi. I'm coming to see you. How about that? I'm gonna get on your books. Hopefully I can
Yeah,
get on your books in
love
2025.
it. Love it.
We can have some conversations and start this partnership and create a healthy living and a healthy life for myself. So I'll definitely be in contact. And everybody else out there, I hope you are able to catch some things that can help you or a loved one from this conversation, because that's what it's all about, inspire you. Big shout out to Eskenazi Health and Dr. Rhyant for being a part of this. I definitely appreciate you. And I'm sure we'll talk and see each other real soon.
Well, thank you so much for having me on your show, and hopefully been helpful to somebody. And I just wanted to kind of say before we check off, lifestyle makes a big difference. You know, how you live, your habits, exercise, sleep, how you eat, how you handle stress, manage stress. All these things have an effect on your health. And that's way before we even get into these ideas of screening for things, or, even if you start having things and having to, mitigate, establish chronic disease. So, just know that there's a lot of things you can do even before you get sick, but that, now is the time to start those relationships, to have those discussions so you don't have to get sick. We don't want to see you sick. We want to see you well.
No, definitely. Just before I get you out of here, is there a phone number, somebody seeing this and they're like, you know what, I need a primary physician and I like how he talks, I like what he says. Is there a way for people to contact you or get to your office?
317-880-0000.
Okay. Thank you once again.
Yeah, you're welcome.
Yep.